All right. Greetings, my fellow Americans. Um, this is President Kim, and just wanted to address with you just the suffering as well as uh, just the difficulties that our nation has been going through in since the start of the pandemic. But at the same time, I hope to just encourage you and just enliven your spirits during this difficult time. Um, so as you may know, back in December 31st of 2019, the first clusters of cases were discovered in Wuhan, China. And just about a month after, as the virus began to spread, about 10,000 cases were reported globally, and this included the first case here on American soil. And this occurred on January 20th, 2020. On April 24th of 2020, there were over 2.7 million cases globally, with over 194,000 deaths across 184 countries. And on June 5th of 2020, there were over 6.75 million cases, with over 393,000 deaths across 210 countries. And so, in response to the COVID-19 virus, our UN Secretary General had enacted a public health emergency, and this was issued under the Public Health Service Act, which authorized funds and facilitated the rapid development of diagnostic testing, antiviral drugs, as well as vaccines. And through this, we have been able to invest heavily into Pfizer's vaccines as well as Moderna's. The wonderful as well as just hardworking and intelligent researchers, as well as the scientists, have been working around the clock in order to find a cure for for us. And so we as a country ought to continue to just support them, as well um, as well as keep them in your prayers, and for a swift discovery. And on March 13th of 2020, I declared a national emergency under the National Emergencies Act. This had waived federal rules to facilitate telemedicine as well as increase hospital capacity. By that time, here in the United States, we've been having ever increasing cases, and I've been informed by our medical officers as well as the CDC that the capacity at specific hospitals, especially in New York City and Los Angeles, have been filled to the brim, and the doctors there, they've been having a lot of difficulty to managing these patients. And so we have to give them our full support, financially, as well as through non-financial means as well. And so I made sure to enact this, and also at that same time, also declared an emergency under the Stafford Disaster Relief and Emergency Assistance Act. This asserted the preeminent responsibility of the federal government to take action in light of a nationwide pandemic. And so this will allow the federal government to make recommendations, as well as enforce certain protocols, and um, in order to make sure that um, our U.S. Constitution is still at the forefront. This the decisions that I'll be making will be um, amongst trusted advisors, and we'll continue to work with state governors as well to determine what may be the best course of action during this time. As you know, in March 2020, I began issuing travel bans of non-US citizens from the Schengen province, as well as countries such as Italy, Ireland, the UK, as well as Iran, where these countries were most hard hit by COVID-19. And so in order to, by taking public health and the public health recommendations, as well as listening to trusted and well-qualified medical advisors, believe that this may be the best course of action. And in order to lessen the severity of the cases that were occurring here in the States. As you may also know, our CDC, they have recommended advisories against domestic travel. And in light of the right to domestically travel upheld by our US Constitution, I decided that it would be best to enact specific safety travel protocols. These protocols were devised by working with our state governors, and we have come to a majority agreement that specific CDC's guidelines be upheld during this time. This would include specific airline capacities, as well as the mandatory usages of masks, and as well as specific quarantining protocols before, or rather after traveling, as well as specific tests that may be needed in order for one to travel. And just wanted to make sure that the public, to ease public concerns, I want to let you know that I've been working closely with the leadership, both internationally and domestically, with the World Health Organization, our Center for Disease Control, our medical and animal officers, the Minister of Health, as well as our state leaders. In order for us to stay organized, to be efficient, for us to decrease the number of cases and deaths in the US, the transparency and the hard work of the World Health Organization, as well as our Center of Disease Control is needed. And so we will continue to work with the CDC as well as the WHO, and just provide any support, as much support as we can, including data for upper COVID numbers, as well as financial support. And I just wanted to recognize the CDC for their quarantine efforts, as well as their hard work, specifically in the instance of the repatriated citizens from the Hubei province, and the 2 cruise ships. And just wanted to let you know that the data that is being gathered at the local cities will be directed to the CDC. And in order to continue to build up our relations with our global leaders, we will continue to send this information to the World Health Organization as well. And just to let you know as well, through the CARES Act, You've received your stimulus checks, and small business owners as well as just large business owners have also received support as well. And this will continue as we speak to Congress and the Senate to push for more stimulus checks. And we will continue to aid in our global vaccination efforts through financially supporting research and also supplying countries that were just hardest hit by the virus by supplying them medical supplies and masks. And so, as you know, please continue to shelter in place. If you've been around anyone that may have been in contact with COVID-19, continue to wear your masks and social distance at least 6 feet. And during this difficult time, although we may be apart from each other, we can and we must pull together. And so stay safe and be well.